Thank you, Kevin, for giving me an opportunity to meet with all of you this afternoon. LRF, as you all know, has been recognized more and more, not just around the country, but throughout the world. And it is recognized primarily for the fine work they have been doing in improving the lives of blood cancer patients. I have the opportunity and the fortune to be associated with this organization for the past probably more than a decade. And there are several ways I have contributed, but on the other hand, every year my association with the organization has really gotten more and more strong, primarily because of the individuals I work with, starting with Kevin, as well as some of the programs I have been very much involved, including the town hall meetings, which is held every year, and also the treatment options conference that is also held every year. These meetings are wonderful opportunities for the patients, their family, as well as loved ones and friends, for meeting with a set of doctors and care providers from various institutions in the Chicago land, primarily university and major other medical centers. These patients and family members and friends, they ask questions and they get the opportunity to hear from different physicians and care providers from different institutions. More than getting the questions answered, many of my patients found it useful because they were able to meet with other patients and family members who are going through this ordeal. As you know, when someone is diagnosed with cancer, more important information they get from somebody who has already gone through that or somebody who is going through it. In fact, the information they get from such source is much more important than sitting down with the patient for an hour, with the physician or the provider for hours. So that was one of the best benefits I have seen in patients with these programs. And LRF has been pioneer in organizing this kind of programs, and Linda Cabot, I'm sure you all know, who was the patient relations director, has been instrumental in organizing these programs and led to the success of these programs. I also want to take this opportunity to thank the more than 1,000 volunteers of the 24 volunteer chapters that Kevin has mentioned. It's an amazing job you are all doing, and I want you to make sure that you know that, because over the last 62 years, LRF has raised $56 million, which comes to about $1 million every year net income, which is directly used for the patients, for the benefit of the patients. And that's not a small amount, as you can imagine. And it's all because of all the perseverance, tenacity, and the determination you are all showing, and we need to continue this. I want to congratulate you for many of the things you have already done, and just to get examples of 2 or 3 situations where the money that was raised by you have helped in making a difference in the patients' lives. I want to say 3 examples. One is lymphoma. As you know, lymphoma is one disease where a monoclonal antibody was approved in this country for the first time by Food and Drug Administration in 1997. In fact, that was the first monoclonal antibody approved for treatment of any cancer in this country. Monoclonal antibody, as you know, is a targeted treatment where the drug goes specifically attached to the cancer cell, kills the cancer cell, leaving all the normal cells alone so that the patient does not have side effects, because most of the side effects of chemotherapy and radiation are because the normal cells are affected by the treatment. And the more important point is, after this drug came to the market in 1997, there are several other cancers in which monoclonal antibodies were developed, lung cancer, breast cancer, but they were all based on the principles we learned in lymphoma research. And that's why it led to development of many treatment options for many other cancers. So that's one. The other example I want to mention is chronic myeloid leukemia, or CML. As you all know, There's a tremendous difference in the way we treat patients with CML now. That's because 15 years back, for example, if I diagnose a patient with chronic myeloid leukemia, the first day itself I will talk to them how many brothers and sisters you have, because transplant, stem cell transplant is the only way I can ensure long-term remission. Whereas today, they just take a pill every day, and 95% of the patients are alive and healthy, carrying on with their lives more than 10 years. And that's because of the development of drugs, targeted drugs which act specifically on the cancer cell. The third example is chronic lymphocytic leukemia. As you know, CLL, or chronic lymphocytic leukemia, is the most common leukemia in the Western world. And today, the treatment is primarily chemotherapy or stem cell transplantation for those patients who are able to get to that. Whereas CLL is one area where there is very promising research that has led to the development of at least 2 pills, oral agents, which are very likely to be approved by the end of the year, which means most likely CLL will also be following the same history as CML, where the patients will be taking along with their multivitamin pills, 1 pill a day, and keeps the disease under control and continuing excellent quality of life. So I want to congratulate all of you to be contributing to this kind of developments in blood cancer research. But remember, our work is not over. There's a lot of work that needs to be done. So please continue the work you are doing. We have to continue doing it so that one day we can say, as Dan said, that we have cured every cancer. Thank you.